So we have Cheryl here. She's 50 years old, and this is the age where women go, you know, I look a little dull, I look fallen, I'm not symmetrical, what can you do for me? So for somebody like Cheryl with her bone structure, her facial features, I like to use a product called Sculptra. Why? Sculptra volumizes the whole face. It just fills the face beautifully, gets rid of some of the shadows. So if you look at Cheryl, she's been somewhere else and they told her, well, we'll put a little bit of Juvederm into your nasolabial folds. We put a little bit here. But you know what? You're not addressing the whole volume loss. She's lost some bone, she's lost some muscle, she's lost some collagen, fat, and that's what we need to address. So you see the hollowing in the temple, the hollowing along the cheekbone. Smile for me, please, Cheryl. So when she smiles, now go ahead and relax. You see where the apple of her cheek used to be? Right there in the middle. But look where it's gone. It's dropped and given her this jowl. So what does Sculptra do? Sculptra fills here, and we're going to fill here. And the chin, you see how the chin is curling up? So volume loss must be addressed on the whole face, and that's what Sculptra does. Sculptra is not an immediate gratifying fill like Voluma or Juvederm Ultra is. This is slow. This stimulates your own skin to make collagen that then lasts for 3 years. So this will fill, but it'll take a good 6 months before she's totally happy. So Sculptra, what is Sculptra? Sculptra is suture material. If you've had surgery, everybody's had Vicryl in their belly or wherever you've had surgery. That makes your skin make collagen when you do a suspension of the Vicryl in the skin. So it's a very safe, effective, volumizing procedure, not just a filler here and there. It volumizes the whole face. That's why I love Sculptra for Cheryl.